Hi everyone, good morning. Welcome, welcome. Thank you to the members of Pegasus Institute and all attendees, both here and virtual. My name is Ebere Chukuptis Akadema. I am a registered nurse, and I am also a doctoral student in the Health Policy PhD program at McMaster University. I'm also one. I'm also one of the nursing and health policy analysts at the Canadian Nurses Association. Thank you to the Pegasus Institute for the invitation to meet all of your lovely and warm faces and for the opportunity to speak to you all today. So before we start, I want to quickly make a land acknowledgement. In Canada, we live, learn, and work on traditional Indigenous territories. We are all direct beneficiaries of policies of expulsion and assimilation of Indigenous peoples during and since the time of settlement and confederation. So CNA acknowledges that the land upon which we are meeting is and continues to be the home of diverse First Nations, Inuit, and Métis people, and that this campus is situated on the Haldimand Tract, the land granted to Six Nations that includes 6 miles on each side of the Grand River. In making this acknowledgement, we recognize that nurses have a responsibility to learn the harsh and devastating impact that colonization has had on Indigenous peoples past and present, and we have a duty to respond to the calls to action of Truth and Reconciliation Commission of Canada. Now, diving in, when I got the invitation to present, which was literally last week, Monday, when my manager threw the task at me, the first thing I thought of was surely I cannot relate because I am not an internationally educated nurse, though I know a few internationally educated health professionals in my circle, including my mom. Now, for context, my mom has a degree in nursing, in midwifery, and a master's in public health. She practiced in Nigeria, in Belize, and Panama, and we came to Canada in 2014. It was not until 2020, during the pandemic, that she eventually got her license. I thought about what I wanted to say today, and I did not want to paint a gloomy picture. You know your experiences more than I do, and at the end, I would love to connect one-on-one to hear these stories. But in the next 30 minutes or so, I am going to do my best to offer you something else. I want to offer you something that has kept me in the profession and something that I think every one of us need, which is hope. So a few weeks ago, I was attending a webinar hosted by Public Health Ontario, led by Dr. Nadine. And Dr. Nadine began the presentation with a discussion of Greek mythology about the Pandora box. She likened the state of nursing to the mythological box that when Pandora, out of curiosity, opened, unleashed a lot of sorrow and pain on the world. Now, Dr. Nadine was not the first person to use that analogy with regard to the nursing profession. On the internet, there are so many stories that, depict the daily realities of nursing in the workplace. And today, I'm sure you will hear a lot of people, including myself, talk to you about the challenges that internationally educated health professionals and perhaps nurses at large face. I have a few of these challenges noted here regarding the barriers that internationally educated professionals, especially nurses, face. IENs are integral to the nursing profession here in Canada as they make up 10 to 13% of all our nursing workforce. Yet their integration into the system is nothing short of disappointing and exhausting. If we zoom out just a little bit, you will see that integration is just one half of the issue because Canada is not retaining its nurses either. In Canada, 40% of all nurses, 40% of nurses the age of 35 leave the profession in their first 5 years, and almost 18% of newly licensed professionals newly licensed nurses to be specific, quit within their first year. Yet it was from Dr. Nadine that I first heard the full story of the Pandora box. Pandora, in an effort to control the mess, closed the jar and trapped hope in the jar. There are many interpretations of this story, yet I choose the interpretation where hope in the jar functions as a sustaining power, as a gentle reminder that there is light at the end of the tunnel, that there is a better future to reach for. Hope remained when all else was lost. And it wasn't until I joined the Canadian Nurses Association that I realized that much of the disappointment could have been shared rather than borne alone. There is a saying amongst my people, I am Nigerian and I am Igbo, and there is a saying among my people, Echo iga osiso ga onwegi, Echo igataka gina mado yiri, which really translates to, if you want to go fast, go alone. If you want to go far or further, go together. So I am not saying that hope is trapped in nursing or organizational memberships, but what I am saying is that hope is harvested within organizations, and it hopes to make nursing better, and and in hopes for internationally educated nurses to be integrated smoothly, and not just integrated, but for nurses to really be retained in the system cannot be done alone, as the issues that we all encounter are systemic, not individual. Which brings me to my point: the CNA. Who are we, and what do we do? Well, thank you for asking. So we we are the professional, and we are the oldest nursing organization in Canada, and we were founded in 1908, and we are 118 years old. So we're really quite old. We are the professional voice of nursing in Canada at the national level, and you will hear me repeat this line quite often, and we are one of many globally. We represent all categories of nursing students, retired nurses across Canada, and we are on a mission to unite nurses and make nursing better. We represent over 498,476 nurses in Canada, and of that number, internationally educated nurses make up 58,540, so about 11.7 to 12%. We are guided we are guided by six values: courage, equity, diversity, excellence, innovation, and trust. And we are also the body responsible for setting out the code of ethics that all nurses in Canada must adhere to. And I was saying I wanted to highlight this because we know from experience and from research that internationally educated nurses face a lot of discrimination in the workplace. As a result of that, Value 5 of this Code of Ethics, the most updated version, explicitly prohibits any kind of discrimination or microaggression or judgment against internationally educated nurses. On the screen is also our roadmap, our current roadmap that informs our priorities on what we continuously lobby. And the integration of internationally educated nurses is embedded throughout and explicit, and it's very explicit in the first pillar, which is about improving access and quality by implementing both policy levers. And specifically, we are asking the federal government for licensure processes for internationally educated nurses to be harmonized. And we also know that integration is one part. Getting a job is one part. There is also a much bigger picture that is about settlement, about access, about socialization. Our values are also framed across many domains, which we are, again, actively working on: policy, practice, research, leadership, and education. Under policy, there are two sub-themes: advocacy and nursing policy. And we are the only professional nursing organization to fill the role of leading health policy development for nurses at a national level. We also meet regularly with federal elected officials, and we sit on more than more than 2 dozen national tables. With regard to practice, I mentioned the Code of Ethics earlier, but we don't just produce the Code of Ethics, we also have stellar certifications, and we usually reserve this for mostly employers. That certification we mostly reserve for workplaces, and we do this because we want to make sure that they are providing better quality of care, that they are retaining their employees, and that patients also have higher satisfaction. And we review organizations against six pillars, namely whether they are promoting nursing voices, whether they are promoting leadership excellence for nurses, whether there is education and career progression very explicitly laid out for nurses, whether they are also optimizing care. We are looking at their resourcing as well as their private practice environment. Under research, we run a Canadian nurse online journal for academics, for nurses, for nursing students, for nurse scientists. If you're a nurse, this journal is for you because we do everything nursing. We also run a journal for opinion pieces where we encourage nursing students and all kinds of nurses to really share both informal and personal experiences. We publish practical information, insightful opinions, interesting stories to support all practice domain. And I recently found out a cool thing about: if you go to the website, you can find all of our publications dating all the way back to 19. Jobs are also linked on the homepage, and we run a community forum where people share insights, put out requests for research participants, and you can subscribe to get the weekly newsletters just so you can keep abreast of everything that is happening in the nursing world. Leadership, we also foster leadership across all levels and offer opportunities to network. We have what we call the Canadian Academy of Nurses, which is the first pan-Canadian organization dedicated to identifying, educating, supporting, and celebrating nurse leaders across all regulated categories. all domains of practice. And I think more relevant to you all will be the education section. And I'll speak a little bit more at length about this because the CNA offers certification that is nationally recognized nursing specialty credential for nurses. There are 24 nursing practice specialties, 18 exams. And every this credential really just shows your employer, your peers, your clients that you're dedicated. And certification is a really great way to demonstrate continuing competence in your nursing specialty. To become certified, you must pass a rigorous competency exam. And if you become certified, your credential is valid for 5 years. Now, if you're thinking, okay, peace, but how can this, how does this work? Internationally educated nurses are qualified and apply to get their to take the certification, even if you're not registered to work in Canada, or even if you don't have enough Canadian hours, you don't even have to be in Canada to take the exam. And all you need is 1,950 hours of experience in your specialty. The experience can come from any country, and all you need is just to be able to prove your licensure and practice hours. The exam is written to Canadian standards of practice and care. And if you don't pass it, please don't worry because you will get a report that shows you the areas to improve on so that you can better meet Canadian standards. And there are no limits to how many times a person can write this particular exam. So this is just more information regarding. And we are launching a specialty certificate exam later in 2026 on trauma nursing and foot care nursing. Now, these are just a few images of our advocacy in action. And these, I really love these pictures because image one is what we call the Hill Day, where our board of directors, staff, we actually go meet federally elected officials and lobby them on some issues. In image two, you can see our CEO, Dr. Valerie Gadisa, dressed in black, and the person wearing the white coat is our president, Dr. Kimberly LeBlanc, our current president. And here they are also talking to the premiers. In image three is also our president talking to media, and we do this regularly to share, nursing perspective on health and nursing issues. Image four is our current CEO, Dr. Valerie Godisa, actually testifying in the House of Commons about immigration policies and ways that we can integrate internationally educated nurses into the system. Image five, we submit our pre-budget consultation, and we submit that to the federal government just to inform the Minister of Health our priorities. And image six, we keep in mind, because I work in the policy world, in the policy department at CNA, we are always sort of keeping abreast of policy changes, and we use policy statements to sort of compel the government into bold action. So there's a lot of wonderful things happening here at the CNA. We also encourage internationally educated nurses to be aware of the Canadian sociocultural context, and I believe Pajan Walsh, who spoke to us about public health, the public health expert also mentioned this. So we encourage nurses to really be aware of the nuances here in Canada with regard to the history and experiences of Indigenous communities, as well as the diverse needs of patient population. And to this effect, we are actually launching a nursing and reconciliation framework, a nursing and Indigenous national reconciliation framework, because we recognize our ethical professional responsibility to champion culturally safer care. And we're doing this against four important pillars: accountability, advocacy, allyship, and anti-racism. We are also planning to launch a disability tax credit campaign to expand and advance the scope of nurses in Canada. And this is very relevant for my colleagues who are already practicing as registered nurses in Canada. As we know, people with disabilities don't, because right now only nurse practitioners and doctors can certify the disability tax credit. So we really want to expand the scope so that all regulated nurses can actually qualify to certify this, because this is part of our daily care documentation. We are already doing the work, and as well expand certification authority. So this is going to launch in early May, and all you need to do is go to the website. You will find a pre-drafted message that you can personalize and send to your member of parliament. And this is just one way that we're not only dedicated to expanding care, but also advancing the scope of nurses in Canada. Now, we have National Nursing Week coming up from May 11th to May 17th. And this year's theme is the power of nurses to transform health. And we have 5 events planned throughout the week. If you scan the QR code, it will take you directly to the webpage where you can find the different events. I'll tell you right now that my favorite one is happening on May 12th, where we get to speak to the Minister of Health from Nova Scotia and the Northwest Territories. And this event is free for the public to attend, public to watch. So please feel free to host watch parties with you colleagues and your students. I'm also looking forward to the session happening on the 13th, where we will have a policy advisor from the International Council of Nurses come in. Now, in terms of expanding with regard to like the nursing workforce in Canada and how to better integrate and sustain, in the past few years, the CNA has lobbied the federal government to enhance nursing workforce to meet health needs through scope of expansion. We've demanded for IENs to be embraced to strengthen our Canadian healthcare system. We are very adamant about including IENs to help shape and inform policy decision. And I also showed you all the picture of our CEO at the House of Commons. I think we have to collect proper data on nursing workforce so that we can better understand where the needs are, and that way we can integrate internationally educated nurses into the system. And I feel that this is very important. Healthcare in Canada is shared by federal government. It is the federal government that funds, but it is the entire care is administered by provincial governments. But it's also the role of the federal government to set immigration level. Census and data collection is also run federally by Statistics Canada. So we are really wanting them to, collect proper data so that we can know fully well where the needs are and we can make evidence-based decisions based on that. As a result of that advocacy, we have seen tremendous system improvements to ensure that IES are integrated. For instance, we've seen significant improvements by regulatory bodies to streamline registration timelines. I can tell you right now that the experience of my mom from 2014 we came to this country in 2014, and it wasn't until 2020 that she got her license. My mom would not have the same experience now because we have made so many improvements in the system. Provincial governments have begun to modernize legislation to support transparent and equitable registration process. I also want to highlight that as a result of the advocacy that we are doing at the federal level, in 2023, the Canadian Academy of the Schools of Nursing, which is the body responsible for accrediting all university nursing programs, received a $2.4 million award from Health Canada to support new nurse residency programs. And they also received an additional $388,000 to support IEN integration into the system. But this work is far from over. While Provincial Nurses Association are really working tirelessly to lobby the government, and again, their actions have really resulted in tangible changes, there is much work that remains to be done level. There are many opportunities for advocacy and policy at CNA. We are working to enhance and expand the nursing workforce in Canada. We value international nursing expertise. We value cultural diversity. We value unique perspectives, and we've been lobbying for the establishment of a national licensure framework so that we can harmonize, the way that nurses are integrated across 13 across all across 10 provinces and 3 territories. So we're not asking for there to be one regulatory body. No, we're just asking for a framework to help the colleges of nurses to regulate and harmonize the process of integration. And in these times that we live in, the work we do is a reminder that we are making so much progress and that the reality and burden and challenges need not to be borne, and that together we can. We need you. We need your voice, your experience, your expertise, your knowledge, your wisdom, your skills. We need your person to make nursing in Canada and beyond better. And you can join us via membership. If you scan the code, it will take you directly to our membership page. Here is what our membership tiers look like. And please don't get scared about the fees. It's not a monthly fee. This is just a one-time annual fee that renews annually. So it's just a one-time fee that you pay every year. And these are some of the benefits that you gain as a member of CNA. Importantly, you're not just joining a body that applies pressure to the government, you're also joining a body that values the inclusion of all voices. In our organization, you'll be heard and your experience will be used to shape and inform policy. And we really need to unite nurses. Lastly, I want to talk about this conference that we have coming up in September of this year. This is an exciting opportunity to meet all caliber of nurses from across different domains and in different stages of their careers. I believe that over 100 nurses have registered. We have nurses across all careers, nursing students, graduate students, policymakers. So many nurses are coming. And if you're familiar with this influencer nurse, John, who is well, yes, who is well known for his nursing skills, he's also one of keynote speakers. So please, this is an excellent opportunity to network and meet people. Tell your friends who are nurses. We are looking forward to having you in Winnipeg. At CNA, we really do envision a future and a leadership that unites nurses. We are to advance the profession, the health of Canadians, and a healthier environment and society. And the battle to advance and transform nursing really cannot be fought in isolation. And I hope you will join us at the CNA to make nursing better. Thank you so much, Ballerine Miguesh. Now I'm going to open the floor for questions. Mhm, 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 mhm. To be honest, I wish I had the full answer. What I will say is that the way that we approach advocacy at the CNA is one, we believe there is strength in numbers, and that's why we sit on more than 2 dozen national tables to help inform decisions. At least what we do at the CNA is directly lobby federal government. You are right to mention that, nursing healthcare in Canada really is decentralized, and there are many things. There is only so much that provincial bodies can do because we know what it is that federal government can do in terms of like making sure that before nurses arrive, that there are already streamlined process at the federal level. That is where we focus on applying more pressure on. So just putting more pressure on the federal government, but really the reality of the struggles that international nurses face are really at the provincial level more than at the national. Yeah, I'll tell you two things. I'll tell you that there is a new leadership at CNA now, and that we are doing our best to make sure that we are integrating all voices, both of our fellows and members, and also of other experts. We are always looking to work with organizations, with individuals that have expertise. Um, we also welcome all kinds of opinions. In terms of the question that you're asking about how we go about like listening to other experts that may not be part of our team, I will get you a response from I'll get you a response to understand the official pathways. I know that when I'm working on some policy cases, I can always tap into my networks. And if we need them officially, we do have to go through a process. So I will get you the full process so that if you have any, we would love to hear you. Yeah. Mhm. Yeah, I thank you for sharing that with me. And again, I will say there is a new leadership at CNA. We are going out, like, we have a new vision, a new direction, and we hope we will continue to improve to integrate voices. And we can chat on the side as well so that I can understand some of the things you're thinking and some of the recommendations that you have. I'll take that back to the organization because we really want to unite nurses across Canada. And of course, it's not going to be a one-day job. It's not gonna be a one day job, but we value diversity. We value, we just, I'll just end it there. We want to make sure that we're representing everyone. So thank you. Any other question for me? Okay, I'll sit around and we can chat and I'll give you our emails just in case you have any questions. Thank you so much for listening.
Thank you so much, Peace. Very informative dialogue there, and also for engaging our audience here with questions, responding to those, and of course, pivoting when the technology decide that it doesn't want to cooperate. We appreciate that. Now we have with us today Ruchigero and persons in the room. So when we do speak a little bit fast, I'm not sure how well they're able to keep up with us. For that, I apologize. Uh, so we try best to see how we can make it accessible as much as possible. So before we have Ruchi Garo coming to speak to us about dentistry and the profession of dentistry here in Canada, for internationally trained dentists, thank you for your resourceful presentation. One thing that I would like to note is that we're not able to a Indian advocacy as a nonprofit organization because if we do so, then we run the risk of losing our nonprofit status. And so this is where relationships like this with the Canadian Nurses Association is quite crucial They form the voice for the nursing profession here in Canada and will support the internationally educated nurses as they come in here. All right. Merci, Peace, pour votre participation riche en ressources. Je tiens à souligner que nous ne sommes pas en mesure de faire de plaidoyer pour les enfants infirmiers et infirmières formés à l'étranger. C'est donc un domaine où la collaboration est essentielle afin de faire entendre le vœu. Merci.